The following video is intended to provide a quick reference in regards to the testing and packaging of COVID-19 samples. At this time, all testing for COVID-19 at the Missouri State Public Health Laboratory must be coordinated through the Bureau of Communicable Disease Control and Prevention. Public health staff will determine if the patient meets the proper criteria for a person under investigation or PUI. The specimen collection for COVID-19 requires a nasopharyngeal NP swab and an oropharyngeal OP swab by standard collection methods using only the synthetic fiber swabs with plastic shafts. Once collected, the swabs should be placed in separate, sterile tubes containing viral transport media. Bacterial transport media cannot be used as an alternative. Sputum samples may also be collected only if the patient has a productive cough and should be collected in a sterile, leak-proof container. Be sure to apply proper infection control techniques during specimen collection. Extensive infection control guidance is available on the Centers for Disease Control and Prevention's COVID-19 website. This guidance will be provided to facilities for each approved specimen, but it might be a good idea to review the guidance ahead of time. This can help your facility ensure adequate PPE supplies and training to use them. All specimens must be marked with the patient's first and last name as it appears on the paperwork. Samples that are not labeled accordingly will not be tested. Once collection is complete, the specimens should be stored at 2 to 8 degrees Celsius if they are not being shipped immediately. Specimens must be shipped on a cold pack within 72 hours of collection. Specimens must be packaged, shipped, and transported in accordance with proper shipping guidelines for dangerous goods. Collection and packaging kits will be available if needed, but if supplies are available at your facility, a kit is not required. The kits will include 2 synthetic fiber swabs with plastic shafts, 2 leak-proof containers with viral transport media, 2 95 kPa compliant tubes to contain the viral transport tubes, 1 conical tube for sputum specimens, 1 freezer pillow, 1 styrofoam box liner, 1 rigid outer box, appropriate Category B box label, 1 list of contents. Swabs will be used for collection and placed inside the viral transport media tubes. Sputum, if collected, will be placed inside the conical tube. The transport tubes will then be placed inside the styrofoam liner with freezer pillow and the liner closed. The styrofoam liner with the contents will then be placed in the rigid outer box. The box will then be properly sealed. The provided label will then be placed on the outside of the box, not overlapping any other markings on the box. Transportation to the Missouri State Public Health Laboratory will likely take place through the routine provided courier service. The MSPHL will coordinate with your facility if the specimen is to be transported by an emergency courier or law enforcement. The outer package can be labeled with 2019-NCOV to expedite specimen delivery upon receipt at the MSPHL. If you have any questions or concerns, please contact the State Public Health Laboratory at 573-751-3334, or you can visit health.mo.gov.